To go, and we're now recording.
Okay, thank you very much. Well, good morning, everyone. Thanks for joining us on an unusual time for a special meeting. It is now 10:03, and I'll call this meeting to order. Again, it's a special meeting of the Seneca Healthcare District Board. We will have a closed session today, just to advise everyone toward the end of our agenda. So we will go into closed session and then resume the open session following the closed session. Looks like we have all of our members present: Jerry Nielsen, Rich Rydell, Kristen Montgomery, and Dr. Walls and myself. Okay. I'm going to start off, I guess, here with the Pledge of Allegiance. Thank you for the flag picture as a reminder. And again, I have to stay seated so you can see me as I do this. So prepare yourselves. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and
justice for all.
Thank you. Thank you. Thank you. That takes us to our public comment period. And TK, I don't know if we have members of the public participating in the call today, so please advise me. I see TK.
At this time, we only have
I'm sorry?
just hospital employees right now.
Okay. Are there any comments? Okay. Board members want to take advantage of the public comment period to make any statements, comments?
Not at this point.
Okay. Thank you all. That said, we will move into item number 5 on our agenda, which is policies and procedures. And by my count, we have 87 policies and procedures to review and approve. So hopefully we've all had a chance to give a look at some of these and see if there's anything that jumps out at you that you want to ask questions about, or you have concerns about, need explanation about. I'm not really sure how to approach this. Is a person on staff available to speak to any questions we have about the policies and procedures?
This is Sadie. I can just give you an overview of why there is so many policies. Respiratory, they didn't make any content changes to the policies. It's just that they had to put them in the board approved format. So that's why there's so many respiratory policies. The Human Resources Department was also updated with correct formatting, and the background check policy is going to be rescinded and replaced with a hiring policy. And the hiring policy contains all the information on the background checks. And all the nursing policies have been revised and placed into the correct formatting due to their annual review. Most of the policies are just revisions for the correct formatting, but there are 2 new nursing policies, which is number 56 and 59. And the surgical services and anesthesia policies have all been revised and placed into the correct formatting due to annual reviews. And Dr. Jensen and all applicable individuals have reviewed these policies. If there's any content questions, I know Casey Burchard is on, and she would probably be able to answer any questions you may have.
Okay, because I do have 2 comments or questions.
And I'm sorry, that's Kirsten. On Zoom, sometimes it's hard to see who's speaking. So if you could identify before you speak.
This is Kristen, and I do have two questions about wording. On the ECG reporting 19.002, in there's a portion where it says that they need to be overread. I think that needs to be flipped. I don't know if that has been done, or if I'm misreading that.
And
then I have one more.
It's called an overread when the physician looks at the tracings and writes the report.
Okay.
So I'm not, I can
So
speak
that's
with
okay.
Diane and see if, okay.
Okay.
Correct.
I mean, if that's okay, that's fine. A couple of us had that question. Also 20.002 on the endo tracheal on the sectioning. At the very bottom, the Roman numeral, the XV on the bottom of that one. At the end of what they're describing, it says not pertinent information. I just wasn't sure why that was there.
Right there.
That's what was in the original policy. That was.
We're not sure on that one, so I will have to get with Diane Dowden and ask her if that needs to be taken out, because it doesn't really make sense.
Right, it's not in with the description, so. Okay, that's all the questions I had.
So with that change, would that require us to bring that back for independent approval of that one policy?
I believe it'd be best to table that one and bring it back, yes.
What was the number on that again?
20.002,
Okay.
and it had that endotracheal, the suctioning one. There were two under that same number, I think.
And that was respiratory therapy, right?
Respiratory, yeah, I think so.
Yes.
Okay. So are there additional questions from other board members? Comments, questions?
I was just wondering how you want to do this, Ken. Are we going to do it in sections, the way they're broken out on the agenda? Like respiratory therapy revised, we're going to make a motion and approve all of those except for that 20-002, and then moving that way, or how would you envision us doing this?
That's a good question. I was thinking that as they're identified on the agenda would be the language we would use just to simplify it. Policies numbered 1 through 87 on the agenda. I'm not quite sure. Does anybody have a suggestion?
We can approve all the policies at once.
Okay,
Yeah, that's what I kind of think too.
all right.
So again, any comments or questions related to any of the policies that are on the agenda? Somebody's waving. Casey. Okay, no comment? Okay, I saw you waving there. All right.
Oh,
I see. Bye. All right. Good. All right, so we'll need a motion to approve the policies 1 through 87 as described on our agenda today. Can I have that motion from someone?
I will make that motion minus number 12.
Minus number 12, which is,
and
put it down here, 20.002, section 1, is that correct?
Yes.
Okay. So Jerry Nielsen makes the motion to approve the policy revisions. And I need a second.
I'll second.
Okay, I think I heard Kristen first, so I'll go with that. All right. Dr. Walls? How do you
I'm in
vote?
favor.
Okay. Rich?
aye.
And let's see, Jerry?
Aye.
And Kristen?
Aye.
And I vote aye as well. So that motion carries with the exception of the one policy in there that will be brought back on a future agenda. Perhaps we can add this to our regular session.
Yes, we'll get that answered and have it for the Thursday board meeting.
Okay, that's great. Thank you so much. And that takes us up to item 6, which is the bylaws committee update. And did I miss something? No. Jerry Nielsen has submitted everyone a copy. I was working on this, and the copy has been submitted to everyone for review of the bylaws. I wanted to just take a minute to thank Jerry for all her hard work on this. I originally started working with her on the bylaws way back when, and we tried to consolidate some of the language and get input from other sources. And it's gone through several iterations, and Jerry has single-handedly taken the lead of making all the necessary edits and changes within the document. And I'm sure that was kind of a monumental task. So Jerry, thank you for doing that.
My pleasure. Someone had to do it.
It's a big job.
Good
But
job.
yeah, Jerry, can you just walk us through before we take a vote on this or have a comment on it, what the changes have been along the way, just the processes it went through? I know it went to attorneys, it went through the public comment period here when we had some initial meetings. Can you just walk us through that?
Yeah, we had staff, we met with staff to review and walk through. We compared our bylaws to some of the other healthcare district bylaws that were considered best practices. Our bylaws had a lot of legal verbiage taken directly out of code that was actually cemented into the bylaws. And as we all know, laws change. So we tried to clean that up and pull out as much of that as possible while still keeping it very clear and easy for the public to, especially to understand exactly what our bylaws were. So really we took out a lot of redundancy. We cleaned it up and pulled out legal language that could be subject to change as much as we could, while still, you know, keeping it documented about how the organization was set up and being governed. And then, let's see, I'm skimming down to the end. We also added references to legal code so that if anyone wanted to look up more information, specifically the information about the Brown Act and the California Health and Safety Code, as well as a link where people can find California legislative information related to it. And then we also just added at the end what the board had approved as far as the, let me find it. The authorization of the CEO, that information was added as an addendum. So I don't know if there's any questions about any of this. I think we've gone over it a million times.
Questions, comments from the board?
Yeah, I would like to just ask Jerry if she has any ideas about going forward, how often the bylaws should be looked at and revised, because it seems like it's a big job if we wait another 10 years to do it again.
It is a big job. I would expect that the board should probably look at them once a year. Now, they probably won't need to be revised once a year, but I think that someone should at least, you know, read through them and just make sure that nothing major has changed and that needs to have a revision. Because I agree with you. I think that they do need to be looked at on a regular basis. And I don't think they've been touched for, like you said, about 10 years or so.
The last time they were,
Maybe even longer.
last time
longer.
they were written, it was because we had a state inspection and they cited us for bad bylaws.
Oh, no.
Yeah. So here's the hard question. I'm going to ask it. I don't want to ask it, but I have to. I think I have to. Does that language need to be included in the bylaws, or can we work around that as a policy, or how do we approach what Dr. Walls is suggesting, that we have some process for an annual review?
I think that we just set it into maybe a board policy that the bylaws committee needs to review the bylaws once a year. I don't think that needs to be set in the bylaws.
Okay.
Personally, I don't know if the rest of the board would disagree. We can always add that if we need it.
Agree.
I would agree also. Rich, did I hear agreement from you?
Yes, yes.
Yeah, I would agree also. I think that you can just appoint a bylaws committee each year to look at the bylaws.
Yeah, and I just pulled them up again and I looked at it because we had added in a time frame for how often these committees were supposed to meet, and it does say the bylaws committee is supposed to meet at least annually. So that I think it's already in there.
Okay, well then that should actually cover it. And perhaps at a future meeting, then we can select some individuals to continue the bylaw committee, just so it's in place. Not that it has to take any action immediately. All right, can we have a motion then to approve the bylaws? Revised bylaws.
I'll make that motion.
Dr. Walls makes the motion to approve,
Second,
and Rich Rydell seconds. Christian, how do you vote, please?
Aye.
Okay, and Jerry,
Aye.
Dr. Walls,
Aye.
and Rich,
aye.
and I'll vote aye as well. Again, thank you, Jerry. It's a lot of work, and I like it that it's consolidated now, and it's a much easier read. Okay. Bear with me for a second. I embedded my agenda in the bylaws. Here it is. So we are now at that point where we can go into closed session, TK. TK, I just want to advise you that Jerry has agreed to send you a text at the conclusion of our closed session, so you can rejoin. Want to make sure you got that message.
Okay.
Okay. So I'm not feeling compelled at this point to take a 5-minute break as we traditionally do. I'd like to move right into the bylaws unless someone requires a break. Move forward?
Yes.
Okay, let's go into the closed session. TK, can you tell us when we are closed and no other people are with us?
She's gonna pause everybody and she'll come give you a thumbs up when she's ready.
Okay, thank you.
Okay, Ken, this is TK. I've resumed recording.
Thank you so much. We are now back in our regular session. Just as a report, what happened during our closed session, there was no reportable action taken. The committee, the CEO selection committee advised the full board of the status of the interview process. We have agreed to move forward with final candidates in the weeks ahead. The selection committee will advise people, invite people back for a second round of interviews. Okay. Questions, comments before we close?
I would just like to thank all of the staff and the providers and community members who participated in these interviews. It was very helpful, and it was great to get everyone's perspective on each of these candidates. So thank you all very much for your time.
And thank you to you, Jerry, as well, and others on the committee. I'm glad we didn't have to go through a headhunter process. So good stuff.
Takes a lot of time not to, but I think hopefully we can get to a better candidate this way.
Yeah, exactly. Okay, our next regular meeting will be June 25th at 3 p.m. And I'm assuming we're going to continue with Zoom unless otherwise noted. So thank you. And that concludes our meeting for the day. Meeting adjourned.
Thanks, everybody.